Welcome this morning. We've got a work session for budgeting purposes, and first up we have Utah County's information systems. Patrick, go ahead and start. This one.
Now it's green. There we go. Some of the graphics will show here. Let me just go to the next screen here. As we talk about what we try to accomplish, it's important for us to sort of keep an overall objective in mind. So a mission statement we've tried to adopt is to be a trusted partner in providing technological innovation that enables departments as they efficiently and effectively serve the county and citizens. The bolded words here in this mission statement aren't just flowery words to us. We actually try to evaluate each project, each message, each action we do against those important words. Starting with trust, we need to make sure our users trust us so that we can form an effective partnership as we try to figure out better ways to do the work of the county in a more efficient manner. So we can talk about a lot of things. Here's just a few items that were accomplished with these types of partnerships with county departments this year alone that aren't just flowery or aren't just a moderately useful application, but actually change the way county provides services. One recent adoption is incorporating DocuSign technology so that we can pass approvals digitally. Long time coming. BMI, Digital Document System, is something that we've had for a while. We continue to develop and rely more and more on it. Basically scan documents that are retrievable, indexable. We use it in most areas of the county, but when you combine DocuSign with BMI, and leverage them both together, they even become more powerful. We've also recently instituted online credit card payments for the treasurer's office for the first time, using instant payment technology. Residents can now do something they've expected to be able to do for a long time. That is to make payments to the county over the internet in a secure way. We'll be rolling out a lot more applications of those uses in the next year or so. A lot of attention has been rightfully focused on online marriages and our partnership with the clerk's office in providing a secure and convenient way for people to apply for and get copies of their marriage licenses. It sounds like kind of an easy thing, but there is a lot of security that goes behind both on the how we store that information to keep it safe, but also how we authenticate the actual seal which is the Titan seal portion of it. That has a huge impact, and you've heard a lot about it. I think you're well familiar with that. That should be rolling out. Our first use, I think, is going to be in the middle of December, and it should be a real game changer. You may have heard about successes in how we reported and supported the most recent primary. I have a slide here. This is actually a screenshot of a slide. It's a great idea. It's a great thing to be able to show the results of an election. But maybe the most important thing about this slide is something you can't see. This screenshot was taken at 8:06 p.m. on election night, which means 6 minutes after that was done, we were able to immediately turn around results. That, again, was a partnership with the clerk's office, and we can't take sole credit of it. Their new counting machines could provide data. Not only could they count fast, but also could provide a file for us, which we were able to pour into this application and have prepared, ready. So it literally is taking a thumb drive from their voting ballot scanning machine into a computer, and 5 minutes later, it's a result. That is something we couldn't have dreamed of doing just a couple of years ago. Something that's even newer that we'll be implementing here in a few weeks for the next election is a way for the clerk's office to track how they pick up their ballots from the voting boxes. What you're seeing here is a screenshot of a map that tracks the status of these pickups. Basically, all the dots you see up there, the glowing dots on the map, are voting pickup boxes. Inside the lid of those pickup boxes that an election personnel person would come, once they unlock the box and open it up, there's a QR code already attached to these. They take their phone, take a picture of it, and it immediately tracks who picked it up, the date and time. They can take a picture of it if there's damage or something they want to report. And then in real time, this dashboard is available downstairs to the election office. So they can see every 30 seconds it updates that those red circles will turn to yellow. That means it's in process, and then when they bring it all the way back and it turns it and we receive custody downstairs, that QR code is scanned again by election personnel and the dot turns green, which now they know exactly how many ballots are out there and what its status will be. Just really big in terms of voter ballot security and stewardship. So these are great things that we're able to do. Saves the county a lot of money, but they're just some examples. We do a lot of different things with relatively few resources. There are some challenges as we try to do more things. One of the first ones is that every time you do something well, people want more of it. And so there's a lot of demand. Another problem that we have is that because our staff has not really grown over the years, but the workload has and the demand has, we've kind of assigned projects to individual programmers and individual staff, and they are each doing those largely on their own, which is a problem going forward if there's ever a case of their not being here for one reason or another. So some redundancies really need to be ensured so that we can make sure these important applications and functions stay functioning regardless of who's at work that day. Also, in our support area, every year we add dozens and dozens of more computer equipment that need to be supported. That inventory will obviously continue to grow over the years, and yet we're still functioning at the same staff levels as we have over the last 15 years. So how are we doing these things? Well, in our programming group, we have 12 full-time programmers. They are currently supporting about 106 applications throughout the county. If you take all these 12 programmers times 80 hours of pay period times 26 pay periods, every year we have at our disposal about 25,000 hours of programming. What do we do with those hours? Well, this is what we currently do with them. Or at least this is what we did between August of 2018 to August of 2019. Of course, the size of the slices of pie change from year to year, and depending on what project we have, what need we have at the time. The size of the circle, though, doesn't change because we only have what we have, those hours of programming. I thought this was actually enlightening to me to see how those resources are generally focused. As I've gone around to the different departments, there are a lot of asks for more and additional programming. These are the biggest of those asks. There's, of course, many more than we can list here. The number after those are roughly an estimate of how many programming hours it would take to complete that whole ask. Maybe point out a few here. In the clerk's office, we would like, and the clerk's office would like, to rebuild the user interface to make purchasing and finance management easier and more accessible. The database behind the finance program is very good. It actually is extremely powerful to those who know how to use it and those who have the right permissions. But it is a little hard to learn how to use it. We would like to make that much easier. We would also like to make it available so with the right permissions, someone could, like yourselves, for instance, approve things even when you're not around, or not in the office and on your laptop, that you'd be able to connect to it over the internet and that kind of thing. That's just one. That is a huge system, as you are aware, and that will take a lot of hours to actually execute. But there's many more. We would like to, for instance, to rebuild the commission agenda program to allow you a more direct access to making changes later on in the week, rather than having to rely on one of my staff members to do it because there really isn't a way for you to do it without talking to them. You should have that ability to do that. That will take a little bit of time. We'll need to reprogram that in a different platform than it is currently in. There's many, many more. Chris Polson is adopting a whole new CAMA system, which is their computer-aided mass appraisal system. That will need to be reintegrated into our land system, which is the green section, and our tax collection system, which is the gray section. This is an extremely integrated system currently, and to upgrade one part means we need to upgrade the other parts too to make sure that they talk to each other appropriately, so that not only we know when a property is recorded, but we also know how to charge and collect its taxes. And it passes through all these hands before it gets there. If there is a mission critical piece of programming function to the county that affects more people, I'm not aware of it. This land system and the blue, the gray, and the green all need to work together. And they all need some attention, and quite a bit of attention. Well, if I add up all these asks, as you can see, well, I don't have any extra hours in the 25,000 hours, and this would take another 27,000 hours if these estimates are, and these are probably conservative estimates. Now, obviously, a bunch of these projects are probably multi-year things that we can spread over time. But I think the point I'm trying to make is there just isn't a lot of ways we can address these issues at our current staff levels of programmers. So this is what we're asking for. Under a high demand for more programming production, we've already done things that don't require any budget infusions. We've moved staff around into trying to maximize who's good at what, so that we can get more production out of the people we have. We've moved them into little groups so they can work together a little bit better, and we've even rearranged some of our administrative staff over to help with support. We would like to adopt a whole new continual training program. And that is one of our big asks, understaffed training. We've asked for around $17,000. And what that would do would give us, each member of IT, an administrative account onto a a site called Plural Sites, which is a computer training clearinghouse company out of Farmington, Utah. It's a really great company, and what this would do is this would unveil the entire catalog of their training unlimitedly for anyone who has an account, an enterprise account, which is what we would want. That's great because the sky's the limit. They can be trained over everything, and it's around $540 a person. There is no other way that I can think of that I can provide universal training opportunities to an entire staff. And we could easily eat up $17,000 by sending 2 or 3 people to 2 or 3 classes, programming classes. But with this, they can not only get those classes, but they can take them and they can go back later on and retake it. There's other aspects to Pluralsight that's unique, that's really great, and the fact that it has an administrative function. So supervisors can actually monitor progress of these training. So they can actually see when somebody's, well, they can't just, we don't have to take it on an honor system. No, I took the class. A lot of these classes actually have tests at the end where a supervisor can actually watch performance. What I'm recommending is not only that we do the $17,000 for Pluralsight, but that as a staff, we require every staff member to take 40 hours of training that is approved by their supervisor. So it can't be just anything that they would want. It would have to be something they could have input on, but the supervisor eventually would have to sign off on it. And that does 2 things. One, with the workload, as much as particularly these programmers have, it's hard to voluntarily make time for training. And yet training I don't know of another industry that needs training more than IT staff, because technology is changing all the time. All the time.
Patrick,
yeah.
can I make a couple comments.
But
First, going back, you highlighted a lot of the initial successes this year.
Right.
And I think, I've been aware of those throughout the year. Those who are involved in those projects were very, very satisfied.
Right.
The elections one, for example, I know that people at the state, people at neighboring cities are wondering, wow, where did this come from?
Right.
And they were kind of shocked to hear that it was just an internal tool built in our county. So I think that that's a great example. I think the next step of showing the value add that these technology services provide is to show how it enhances productivity.
Right.
Because what we wouldn't want to do is create a situation where we're enhancing technology across our departments. I'm looking back at your pie chart now.
Sure.
And instead of getting enhanced productivity and output, we're actually adding more bodies to support the programs, more programs and more bodies to support that, and still have all the same existing staff.
Right.
And so I know that's not really, it's hard for you to include those in your outcomes, but that should be you're looking at the total number of hours, but one of the ways we justify this expense and investing in technology is, okay, now does the clerk auditor, marriage license, for example, if that is fully automated and all of a sudden all of our traffic shifts to being online,
Right.
we're not going to need the same amount of staff hours
Exactly. Right.
supporting that program. So then there's a great return on investment there. And that program happens to generate revenue.
Right.
And so that is an element here that I'd love to hear your thoughts on. Is I would hope that all of this technology investment is enhancing productivity. Same thing, purchasing system. That's a major priority in my mind. I see that you have it as one of your biggest chunks.
Yeah.
That should reduce a lot of hours spent in a lot of departments on purchasing, and a long-standing frustration that people have with a system that, as you said, is robust and has a lot of capability, but is very outdated in terms of user interface.
Exactly right.
Do you have any comments on that?
Sure, and I appreciate you bringing that up. I'll give you a couple of examples. the recorder's office and the assessor's office, treasurer's office, and the clerk's office are four of our big users. Those are also four of our biggest asks for additional services. I didn't watch everybody's budget hearing. I did hear the clerk office asking for lots of extra IT programming for just those purposes. And you know that they are asking for it because it's benefiting their bottom line, and it's allowing them to provide a better service. What we would like to do is, and we probably need to do a better job of it, although sometimes it's a little bit difficult from our chair to ask for that type of information. For years, we asked actually for the recorder's office to show, because one of the things we do is we build the system that the recorders use to enter in properties. And over the last 10 years, we've made that much more efficient, which turns out happened just in time because the amount of recordings have gone up threefold over the last decade. And yet, and if we wouldn't have done that, there would have been no way they would have been able to turn their own mandates in on time or even close to on time. Yeah, we would like actually to hear more about that too from our point of view, because hey, we know it's making a difference. We just know it's making a difference.
Can I chime in there too? Because
Right.
on a historical basis with this, we went through a few years ago with Workday, and Workday was sold to us in the sense that it was, technology was going to help out a tremendous amount, and it would relieve people of overburdensome accounting. And even there was departments that said this would allow us to reduce or change staff's priorities to do other things than what was required. And in looking at Workday, now I see they more integration. I think that HR wants to have a full-time person from IT involved, just basically for Workday, and it seems like that's gone completely the opposite direction of what it was intended to do, and that was to help us shrink the man hours involved. Now we're going to where full-time somebody from your office is up there working on Workday on a regular basis. I saw your pie chart with so many hours of programming integration that needs to be there, and so it concerns me. I mean, technology is great, but I again go along with some of the sentiments that were said here. How do we hold that? How do we know if we're getting that bang for the buck when we're talking about technology, and how do we hold
Sure.
it and say this is where we're going to stay with it?
Well, a couple of things with Workday. There's more involved than just the amount. What they were asked to do maybe 10 years ago is different than what they're asked to do now. And I can't really speak for all the mandates that HR legally has to do. They probably could speak better to that. But I can tell you that the vision of how to integrate Workday, which actually turns out in a lot of ways to be a very powerful tool. I can tell you companies both locally and nationally are adopting Workday. It's one of the fastest growing HR systems. There's portions of it that are frustrating to me, as in a lot of other people, but there are portions that work very well. Integrating that properly was probably something that wasn't particularly well planned when it was purchased. Sometimes it's easy to listen to the salesman only when these products come. We're always going to give you a rosy outlook about how easy or how fast it is to just use it. If I could tell you how many times I had a salesman come in and tell me, in 2 to 6 months, you're going to be up and running. These systems are so highly integrated. A Workday, for instance, has to be integrated into 3 or 4 different systems in order to properly get, for instance, our budget officer the numbers she needs to make sure that payroll works. These things are really complicated, and there's lots of modules to it. And I think when we adopted Workday, and I'm not trying to criticize any particular person because I wasn't involved with that adoption, from what I think, just knowing from what I know now, sitting in the chair I'm sitting now, more research should have happened to really evaluate the cost of integration, not just the cost of purchasing. Does that make sense? We can buy a product that comes and it'll work within itself. But if you're asking it to start talking to other systems that are already here and used in our context, that's often underestimated, certainly from a salesman's point of view, because that's not their concern as much as it should be ours. So I think going forward, whenever we're buying a big platform system like HR for something like HR, that needs to be better vetted so that we really understand what it's going to take to make sure it works in our context and how long that will take. It is true, HR has asked for more IT help. I have included some help, not a full-time person like they've asked. There's just no way for me to carve out enough programming hours to make a full-time person there. But certainly, more investment in Workday would benefit the entire county in terms of further integrating that system. And I think that's kind of the take-home with IT. IT is an internal service provider. You can add money, and I don't want to say any other department doesn't have needs, but you can add staff to other departments as you see fit, and that's great. But from my point of view, adding money to the IT department to allow us to extend our services is getting more bang for the buck than just hiring another person and taking care of the need as they see it today. Hiring IT will help us make more efficient tools that will allow them to do more with less over a longer period of time than just adding one more body at the end of the line. Because we can continue to reuse these people, continue to make additional cost-saving tools for every department, like we do now. I guess that's what I would say.
Patrick, excuse me, how confident are you in your tracking mechanisms that you'll be able to prove that carry out over the course of time?
Well, some of it will depend on whether the departments.
Do you have to quantify that? Do you showcase that, or is it just theoretical and then hope you feel?
Well, I sure hope it's not theoretical. I hope we can show more than anecdotal evidence even today. However, some of these, because we're providing tools for a user, will depend on their feedback to how much it's benefiting them. But we will definitely make it a priority for us to start tracking a baseline before we introduce a new tool to allow them better tools to track how their productivity may have changed. Keep in mind the other part of Workday and every other program that we do, that demand isn't a static thing. So whatever the demand was 5 years ago, it's more now. And 5 years from now, it'll be more again. So that is not the same thing either. So we not only do we create more efficient tools to help you meet your need today, but it will need to address a curve that we can never really stay on top of. We just hope to stay in range of. Does that make
Yeah,
sense?
and I mean, that goes back to the headcount issue. It's not that when you invest in technology, you're going to have a reduction in headcount necessarily.
Not necessarily.
But
Sometimes.
sometimes you can, but you certainly can slow that curve
Right.
of growth, like you're saying.
Yeah.
And to me, that's just another couple of examples on that is we have a couple of departments who are on your list of high priority technology needs. They're also requesting a lot more bodies and saying that this is required to get up to their statutory
Yeah.
requirements. And so we just, to your point, we need to have those tools to track because in some cases they're asking for both.
Yep.
And unless we can hold that accountable every year, they could ask for both. And we need to know which solution is actually moving the needle and are those new heads that are being added actually working with higher productivity to reach those goals.
I agree with you 100%. We'll do whatever we can to help you help you have those tools. Again, we will also have to rely on our end users too to give us a full picture of what those are.
Back to the training issue on the plural site, I think this is a great idea. I liked what you were saying that the manager needs to approve.
Mhm.
Because I know that our systems that we're currently supporting are not necessarily aligned with the general market right now.
There are cases of that.
And my understanding is that tool can provide some credentialing as well for individuals.
That's
So as
true.
much as we want to provide training, we do want to provide training on the systems that we support,
Mhm.
and not necessarily just, in the worst case scenario, have someone take a job here, get access to a ton of great training, getting badges and credentials and skill sets that
Yeah.
are attractive to the open market, only to then go be hired in the open market.
That's true. Although I will say, if we have a staff that's being poached, then we have a good staff,
Yeah.
right? So while that scares me, and we have the threat of that every day, our best programmers and our best staff, not just programmers, are always in danger of that. Part of my job is to keep them motivated to stay working here and stay as productive as possible. We do what we can. I agree with you. One of the other reasons why we really want to make sure that our staff training is supervisor approved is because we can see projects we need staff to be working on, and we can tailor that training to assist us in getting to that goal faster. Not training on one individual either. We can train groups of people so they can have a more peer growing environment, so not everybody gets everything out of the same training, but everyone needs to participate if they're working on a similar project, and they can help each other along the way. In the past, we've only had training enough to send 2 or 3 people a year to things. And then what we would try to do is take those people and then have them retrain others as necessary. But it's difficult to find the time to just voluntarily do that. By making it a mandate from me, it also binds the supervisor to make sure he allows his staff to take the time. So his staff doesn't have to feel guilty about, well, I need to wait on that project because I need to finish this training. In the long term, I think that's a better scenario. Even though in the short term, sometimes it's a little tougher. So, any other questions about the training? I'm really excited about it. One of the first things I did when I took this job is I interviewed each member of our IT department, and I also sent them a survey of things that they would like to see changed. And 3 things came back. And one was they wanted more teamwork. 2, they wanted more communication so they knew what each other was working on. And 3, they wanted more training. That was universal. I mean, I would say 80, and it wasn't prompted. It wasn't like there was this bucket, drop-down list of, hey, are you interested in these things? These are things that just kind of came up organically in their responses. I couldn't agree more. We need to do more to help us stay forward-looking and forward-able. So staff training is really important. Our last ask is a big one. Under high demand for more production, I'm asking for 3 more programmers, 2 of our highest level programmer 3s, and 1 of our lowest level of programmer 1, to help us build more team environments. And I have a slide in a minute that'll show you sort of how that reconfiguration might look and what some of those benefits are. Moving over, unless you had any questions about that, we'll talk more about it in a minute. Moving over to needed redundancies, we typically there's not such a thing in my department or staff available to have like a next man up mentality. If somebody goes down, they go down, and so does their knowledge and experience to a degree. And that has been frustrating and scary. And we're not just talking about people always, we're sometimes talking about hardware and infrastructure systems too, but in this context, we're talking about programming. So we've had situations about a decade ago where we had one of our programmers tragically die in a motorcycle accident, and all projects that person was working on came to a halt for a long time. And that's not something you can really plan for. So because of that, because I like the group approach, because it adds more synergy and innovation, ideas for innovation, I would rather the programming function start working more in small teams where they're automatically being cross-trained because they're understanding each other's work and it's work in context with other people. In order to do that, we just can't have a one person per function. And as you saw from that earlier slide, with 12 programmers supporting 106 applications, you can obviously see the math is difficult to spread that work out any further than that. In addition to the adding programmers, we would like to convert one of our programmers this year, programmer 3s, to a new higher classified position called a lead programmer to sort of provide leadership over a team. Eventually, we would like 3 of these next level programmers so we can develop 3 different teams, and I have a slide to show that. But maybe of all the things we're talking about, one of the things that keeps me up at night more than anything else is the fact that we don't have on staff a job description for a function called the database administrator. What we do have is Jay Sundberg, who's the assistant IT director, who happens to be doing that function. And he's done that function for almost 4 decades. And while Jay and I joke about retirement, eventually this will happen. And there is nobody who is qualified, trained, or prepared to take over Jay's duties. Now, a DBA isn't just another programmer. A DBA is literally the captain of the database, the person who designs, provides security for, plans for the future, and keeps invaders away from the database. It is an extremely critical job. I cannot think of a more critical job in my department. And if we don't have a DBA on staff before Jay leaves, we will have a big gap in institutional knowledge, but we will not be able to easily hand over. And it's not something we can even go 2 weeks without having somebody prepared to do. So I would say of all my asks, that's why it's number 1 on the priority list. I think all IT departments our size, all counties our size, and greater, and many that are smaller have a dedicated DBA position. And it is time for us to create one. So any questions about that?
I think one of the questions I have on that, Patrick, is do you feel like this will create more efficiencies in the work time of your employees?
Absolutely.
Back to the team lead scenario, is this gonna, are you confident that that's gonna make them more productive?
I'm not only confident, I think it's the only way to make somebody more confident. I mean, I'm a person who can work independently. Most of our programmers have done that a lot. But our biggest, of all those 5 huge things that you saw at the beginning, all of those were done with an informal team forming, and we were able to be done much faster and better because people had different ideas of how to approach it, and that discussion led to the best solution that turned out to be great. None of those were done by a single programmer. And that was really the best way to do it. Let me go to this next slide. So this slide is the way our programming division is now. Each of the colored circles on the bottom below that line are a programmer, and they have a list of things that they do. And then the next guy has a list of that they do. And the next person might be Lena, who has a list of things that she does. Do they talk to each other? Yes. But for the most part, they work in their own little individual silos because we just can't stretch them anymore. When we have taken small groups of them and we've put them together and said, hey, let's work on this together, we've been able to do projects at least 50% faster. And I'm confident always better when we do that. So we would like to formalize that. And I guess I hit the wrong button, so let me do that. Oh no, I got that right. We have programmers that have more similar experience and tasks. We have what we call web programmers, we have database programmers, and then we have web page programmers that actually design how they look and how they operate. What we don't have is a formalized way for them to work on projects together. What this would allow us to do is just add enough resources by adding those 2 programmer 3s and 1 programmer 2. And then this year, add the lead web programmer in the green. And perhaps next year and the year after, we could add a lead programmer in each of those, of the yellow and blues. So we can create these teams. These teams will allow me, for instance, to have a sort of administrative leadership group where we could decide on how to integrate projects better from the outset. One of the frustrating things, both as a user and both working in IT sometimes, that we'll push out a solution and even the majority of our programming staff doesn't know about that solution or how it could impact them. That's been extremely frustrating, as you could imagine. Workday is a great example of that. We had 2 or 3 programmers working on it, and the rest of the people didn't have time to even know how it affected them, and then it affected them. And then we're trying to catch up. If we had these in groups where they could talk to each other, and maybe they don't have to have every person talking to each other, but their program leads at least working together, we can plan so much better. Yeah, I am
And you're
confident.
just talking about on a large scale basis, because, I mean, there are times when
There-
you don't want 3 people showing up to,
No.
you know,
Right.
to do simple tasks.
But that big donut pie chart that you saw, those are all big projects. Those all require more than 1 programmer to be working on them. But yeah, there's a lot of small tasks that wouldn't be necessary. However, like the green programmers are skilled in that type, so they get assigned that. And the yellow programmers, they're skilled in that type of program, so they get assigned that. And those little projects come up all the time. They're hardly worth talking about because there's, 1,000 of those every year. So we just try to talk about it in groups. So you're right. There's plenty of times where just a single programmer is the solution you need. But the big projects, the ones that are in that 27,000 hour, those are things that we have to take a more holistic approach to make sure we're addressing all the concerns as we move forward. Yeah.
Nothing was more frustrating to me when I was working with the federal government, is to have a doorknob fall off and have somebody from GSA come down there, not just 1, but 2 come down. And they spent at least 45 minutes, looking at it and then going back, and they spent 2 days before they actually put it back on.
Right.
And that was frustrating to see 2 people,
Oh,
doing a
sure.
task that can be done in 15 minutes.
I think
Easy.
for the most part, what you would see is that these lead programmers would be the main liaison between whatever your need was, and they would just decide how many other staff it would take to do it. And so you wouldn't need to see, all 4 wouldn't need to show up unless you're talking about a project that warrants that. You wouldn't see that. Wouldn't be a problem. Okay. That's a good question, though. We frankly don't have time. We don't really have the time to throw too many resources at anything. I don't really see that as a real risk here. For the most part, we're just trying to rearrange our resources to make them as maximally productive as we can. Any other questions regarding that?
One question on the staffing, Patrick. This is your expertise, not mine. But as we deal with unique projects, I sometimes worry, I guess I'm naturally skeptical,
Well, sure.
even though I'm excited for your leadership in the department. Sometimes it makes you wonder if government is the most efficient
Yep.
vehicle for managing IT hours and programming hours. And if we have a backlog of projects, there's also very discrete skill sets that are needed on specific projects. That in the context of government, it's even harder to do a rapid staffing plan,
Yeah.
right? Why would we go and recruit someone with a specific need that we might not need again. And now that person is a merit employee in a government system.
Yeah.
And so I think all of that kind of incentivizes us to be more nimble in terms of using contractors when we need to in a pinch. It's always great to add to the bench, like you're talking about here, if you feel like it's a broad-based skill set that are going to be able to utilize these hours well.
Right.
But do you see a need and a role for us to, when necessary, just use an outside contractor
Mm-hmm.
for some of those more narrow skill sets to make sure that we don't grow
Yeah.
too much?
I absolutely agree. In fact, we actually do that quite a bit. Instant payments was a good example. We had a role to implement that, but instead of doing the whole role, we actually paid for instant payment some of their programming staff to do a portion of that. This part that was their expertise that needed to happen on their end, so that their system can talk to our system. That happens all the time. BMI is another example. We hired them for 10 hours this year just to make sure we could fully incorporate DocuSign into our document handling program. It just made more sense to do that. And I didn't have the resource to throw at it in the time that we needed anyway. So you're right. There are times, especially where time is a big factor, where we need to turn something around fast. It needs to make sense. If that makes sense, then we'll do it that way. We also do it in another way. We do have more than a handful of other systems that we've just incorporated and integrated into ours. Workday being one of them, AssetWorks being a new one that we're just now starting to integrate. Sidwell in the recorder's office, Spillman in the sheriff's office. These are programs that we didn't take the time to reinvent a wheel that the private sector already perfected. Yet, every one of those systems, in order to best leverage them for the uses of not only the sheriff or the recorder's office or anyone else, needs to be integrated into a larger system and talk to each other. So we still do that, but we didn't try to build it. It just doesn't make sense for us to build it. So yeah, there's a lot of levels to that. I'm certainly not against any of them whenever it makes sense, particularly in a rapid deployment situation. So yeah, but we are so understaffed really that that happens probably more often than I even would like. We're kind of way on the other pendulum where we just don't have enough resources to do many of those things. So I'm not worried too much that we're not taking that into consideration, because that's always one of the main considerations that we have.
Thank you.
We might do the very same thing, working with the clerk's office with, like, for instance, travel approval. We could build something, sure. I don't know where that pie it would come out of, so it probably makes a lot more sense to just look at the private market and say, which of these do you like best? And then find a way of integrating that into our larger finance system. And that's our current strategy for that. We'll see how that goes through an RFP process, but.
And the one I've heard, that made some sense to me, and I forget the level of staffing that you have, but, the finance system itself, there's some updating that the programmers can do. But if, for example, there's some design work that needs to be done that we didn't have,
Yep.
that's fine to work with some outside
Yep,
user interface, UI, UX designer
exactly,
in consultation with our in-house programmers.
exactly right. Any other questions regarding that or comments? I'm taking more time than I thought I would be taking. Last thing is our growing inventory of computer equipment. I think this is kind of obvious, but every year more and more equipment gets purchased. Equipment that needs to be supported, needs to be replaced. We need to do a better job of staying on top of that inventory. And because of that, one of our things we've already started working on is building an entire new inventory and procurement system that users will be able to use. This is not something that comes with a budget request, it's just something I wanted to report. Although we're spending portion of our programming time to do it, but we feel like it has enough bang for the buck that we needed to just do it. The idea here is to give every county personnel who has in their stewardship a piece of computer equipment the ability to look at their equipment, log on with their own computer, with their own user login that they're already using. We'll show them what they have, how much they're paying in support for that, how much they're paying in capitalization for that, and what its replacement date would be, and how much money they will have accrued in their recapitalization, so that they can plan more effectively about what they might need the next time it comes up. Or if they decide halfway through a term, this equipment isn't what I need something different, they have time to go to their supervisor and budget appropriately. In addition to just being able to see the status, we will have an interface to allow them to not allow any user, but departments and whoever the department purchasers are approved could initiate equipment acquisition. And it has a lot of information, including all the permissions that need to happen, whether your PO is done, whether the quote is in, whether that thing has been delivered, when it's planned on being installed. So at any point in time, people will know what the current status is of acquiring that piece of equipment. A lot of feedback I've received is the frustration that they just don't know when something's coming. They know they need something, they finally got it approved in the budget, and then they want to know, why can't I have it tomorrow? Well, it turns out our finance policies there's a lot of hoops to go through. You just have to go through them. What this will allow them to do, not only to know what's the next milestone that needs to happen, whether they're waiting for a PO to be approved or even created, or waiting for a quote, or waiting for the order to actually go in, all of those things will be completely transparent. May not solve all the problems about we aren't going to be able to duplicate exactly what Amazon can do now, which is a new thing. Hey, if I order it, I get it tomorrow. But at least you'll know what the next step is. And you can go to that person and say, hey, to your department head, for instance, have you put in that PO yet? Have you got that approved yet? At least they'll know. As it stands now, we have a general sort of level of discontent sometimes when people are just excited about getting or have a need to get their next thing.
If I could just remind you, we've got about less than 5 minutes, and then we have
I think this
next.
is the end of my discussion.
Okay.
Any questions about that?
So I do want to make, there's one point here. This slide almost suggests, hey, look, how can we expect a lot of support because the devices are increasing and the number of technicians has remained static?
Yeah.
There is a counterpoint, I think, to that, which is each department, based on how we budget for this using an internal service fund, is paying a per device per month service fee.
Right?
So as this number has gone up, so has the support fees.
That's right.
And so this is really a decision of the Information Systems Department
Mm-hmm.
to keep the staffing level here.
Right.
And I think that the question is, personally, what I'm concerned about is, and this goes to all of our internal service funds, we can never let this amount get so out of whack where all of a sudden you're charging a per user per month fee
Mm-hmm.
that a department would look at and say, wow, I could get more for less
Sure.
in a competitive environment than what the county's charging me.
Sure.
So I guess it just seems to me that if you felt like you needed to staff this differently, you have the mechanisms built in an internal services fund to do so.
Right. And I am requesting that, and we will go, but I felt like it was important for you to understand why we would be changing our staffing plan, because still a staffing plan would come before this body for your approval, even if it's not necessarily a budgetary thing. We've actually kept the support rates the same this year. I don't know that we'll be able to next year, once you add in all the network costs and the infrastructure costs and everything. But what is clear is this ratio between devices and support staff is something that does need to be addressed. So I just wanted you to be
No, I'm
aware.
probably on another point with this too, talking about technology, and I'm not speaking from experience on it, but sometimes when I call for help support, I mean, all I do is just say, okay, go ahead and take over my computer and fix whatever's going on.
Uh-huh.
I don't know if that happened back in 2007, or if they physically went up there and looked at it or not. But I think that as technology grows, and it also allows for the help desk technicians to be a lot more efficient instead of actually physically being on site
Right.
to fix some of those. And so although it does grow, maybe the workload's not the same, overall when it comes to efficiencies with the help desk.
Well, I think it's the same dynamic that we talked about earlier. Yeah, that is true. We have found more efficient ways to do it in order to stretch the staff of 4 as far as we can. We adopted the technology called TeamViewer to allow them to take over your computer probably around 8 years ago. And that has allowed us to sort of keep going, but even that is not, we still only have 4 guys to answer the phone at one time down there, and that's if no one is actually physically carrying a computer to somebody else, which is usually the case. So it still takes us to physically go there to set something up. So we always have 1 or 2 people out of that office, leaving us down to 2 left. So it's important. That's one reason why we moved a network administrator back in, to just help cover the volume of calls that come in simultaneously.
Okay, thank
All
you,
right.
Thank you, Patrick.
Thank you. Appreciate your support.
Thank you.
Ralph, you're next.
Stuff off here.
Ralph Clegg with the Health Department. Thank you, Commissioners. I appreciate this opportunity to talk a little bit about the Health Department, needs of the Health Department, the services we render to the citizens. And I know one of the purposes of the transparent process we're following for budget is to make sure that statutory responsibilities are outlined. I'll try to do some of that, particularly those that affect the budget. And then respond to any questions you have about a budget. I have invited our key staff to be here to respond as well, since they probably can answer some things much better than I can. And I'm grateful probably and for you that you're getting to the end of this arduous process of listening to all the department heads. So. But under the Utah State statute, counties are required to create and maintain a local health department, which includes and serves all incorporated and unincorporated areas of the county. Thus, as growth occurs across the county, our countywide service demand increase and statutory responsibilities grow as well. Under the statute as well, counties are to fund the local health departments with appropriations from the general fund, from a levy of a tax up to a ceiling of 0.0004 per taxable value of taxable property, or in part from both the general fund and a tax levy. Grants and fee collections may also be used to supplement local funding for local health departments. This is a much different process or a model than other human service agencies such as substance abuse and mental health, which get most of their funding from federal and state resources with small county funding matches. As we approach the legislature, seeking for additional funding for the continued additional responsibilities we receive from new legislation or new administrative rules, we are often asked how much of the 0.0004 allowed mill levy we are getting from the county. And when we tell them, and then they generally tell us to come back to the legislature when we've maxed out that 0.0004 mill levy. The county, of course, is well acquainted with the unfunded mandates that often come down from the state, and we're not exempt from that as well. But those, like growth, impact what we have to do in our services. Just a couple of recent examples. The legislature recently passed a law requiring local health departments to permit and enforce the laws regarding electronic cigarettes. They set the permit fee at $30 which provides us at least some revenue. But really, $30 may cover the cost of just the paperwork, really, to issue the permit. It does not cover the cost of inspecting the retailer for compliance or for enforcement of violations of the law. Another example is the emergency rule issued for electronic cigarettes this month. This required us to visit each retailer to make sure they were aware of the new rule, and to mail a letter to each retailer to ensure that the owners and corporate officers were also aware of the new requirements. But of course, there was no funding for this effort. As local health departments across the state, we tried to compare our costs for core public health services and local tax funding. To do so and to try to have an apples-to-apples comparison, we have to remove tax funding from certain non-core programs from health departments. For example, some local health departments provide area authority on aging senior services, which, for example, we do not. Some provide substance abuse services or even mental health services, along with a few other programs. We, for example, take out the tax funding in this comparison from our senior programs, Mosquito Abatement, and the county employee healthy lifestyles program. By doing this, we get a relatively good comparison between health departments, though in some instances it may be a comparison of a golden delicious apple to a Honeycrisp apple, but hopefully we're at least at apples to apples, which I'll elaborate on with some examples. Here are the results of our comparisons on a per capita basis for 2018 for core public health services. Utah County receives $3.84 per capita. Now, years ago, this figure was in the realm of about $6 per capita, but this points to how we've been impacted by growth and a tax allocation that has remained relatively flat. Summit County, again looking at our neighbors here, Summit County receives $75.32 per capita. Wasatch County, $23.56 per capita. Salt Lake County, $11.67 per capita. Davis County, $14.91 per capita. Tooele County, $12.29 per capita. The small rural counties to our south and southeast are between $6 and $9.30 per capita. Small rural counties east of us are $17 to $19 per capita. Southern counties of the state are $6 to $9 per capita. Northern counties, $7.41 to $24.51 per capita. The Weber-Morgan area is probably the closest to us. Weber County is at $5.71 per capita, but then they have Morgan as well, which is at $11.03 per capita, and so they probably average out about $6 for their health department. Now, when we compare Golden Delicious versus Honeycrisp, most of the multi-county health departments, which are perhaps the closer to us in per capita expenditures, often own their buildings and do not have to pay rent for those things. Certainly they have some maintenance costs, but often also they are provided with free rent and utilities from the counties where they are providing their services. In some cases, that's true for their IT and phone services as well. State statute asks local health departments to enforce state laws, local ordinances, the state departments of health and environmental quality administrative rules, and local health department standards and regulations as they relate to public health and sanitation, including the plumbing code, state construction code, and the food safety manager certification act. In addition, local health departments are asked to establish and maintain and enforce isolation and quarantine, establish and maintain medical, environmental, occupational, and other laboratory services considered necessary and proper for protection of public health, establish and operate reasonable health programs or measures which are necessary or desirable for promotion or protection of public health and the control of disease, or may be necessary to ameliorate the major risk factors associated with the major causes of injury, sickness, death, and disability in the state. Close theaters, schools, and other public places and prohibit gatherings of people when necessary to protect public health. Abate nuisances or eliminate sources of filth and infectious communicable diseases affecting the public health. Make necessary sanitary and health investigations and inspections as to any matters affecting public health. prepare, publish, and disseminate information necessary to inform and advise the public concerning the health and wellness of the population, specific hazards and risk factors that may affect the health and wellness of the population, specific activities individuals and institutions can engage in to promote and protect the health and wellness of the population. Also required to investigate causes of morbidity and mortality, issue notices and orders necessary to carry out these responsibilities, conduct studies to identify injury problems, establish injury control systems, develop standards for the correction and prevention of future occurrences, and provide public information and instruction to special high-risk groups, investigate bioterrorism and disease, provide public health assistance in response to a national, state, or local public health emergency. In addition, the statute says the local health department shall establish programs or measures to promote and protect the health and general wellness of the people within the boundaries of the local health department. Investigate infestations, infectious and other diseases of public health importance, and implement measures to control the causes of epidemic and communicable diseases and other conditions significantly affecting the public. Cooperate with the state health department in matters pertaining to public health and administration of state laws, and to coordinate the implementation of environmental programs to maximize efficient use of resources by developing with the Department of Environmental Quality a comprehensive environmental service delivery plan. In addition, the statute requires local health departments do the following regarding public and private schools. Enforce all ordinances, standards, and regulations pertaining to the public health of persons attending public and private schools. Exclude from school attendance any person, including teachers, who is suffering from any communicable or infectious disease, whether acute or chronic, if the person is likely to convey the disease to those in attendance, and to make regular inspections of health-related conditions of all school buildings and premises and provide a report to the State Department at the time this inspection is made. And in addition to this, the state statute requires both the Department of Health and Department of Environmental Quality to set minimum performance standards for local health departments we have to meet. And these require us to do things such as conduct community health assessments, which is a rigorous task, taking weeks and weeks of our employees' time. Significant cost to us. Now, of course, we continue to seek for efficiencies there, and fortunately now we are coordinating with Intermountain Healthcare, who is also required to do community health assessments, to provide these joint community health assessments, with IHC paying many of the costs and saving us thousands of dollars. We're also to assess the availability of health-related services, health providers in our communities, and identify gaps and barriers to services, convening or participating with community partners to improve community health systems. We act as the local register for vital statistics in the county as well, and provide evidence-based services in maternal and child health programs. Those are things like WIC, home visitation, baby or baby, family planning, cancer screening, things like that, as well as evidence-based services in injury control and chronic disease control. The State Health Department also has 5 rules for food safety we're required to enforce. They also have rules for schools, recreational camps, recreational vehicle parks, public pools, temporary mass gatherings, roadway rest stops, mobile home parks, labor camps, hotels, motels, and resorts, Indoor Clean Air Act, illegal drug operations, decontamination, indoor tanning beds, all of which rules we're responsible to enforce, including the investigation of complaints about public health. Add to that what the State Department of Environmental Quality rules for wastewater, drinking water, recreational water, used oil, solid and hazardous waste, underground storage tanks, emergency response, etc. Just to outline the requirements we're under and why we ask for the budget. I guess we do under the statute. You know, as we do have a lot of funding from grants, we recognize there are many challenges with grants. Many of the grants we receive are simply small supplements to help us with what we were already required to do anyway. For example, we receive an immunization grant from the state, But under the Vaccine for Children program, where we provide the free vaccine for children, that's federally funded, we're required to do some follow-up and encourage these folks to come back in for their vaccines. And so in providing this service to the public, we have to do these other things. Now, they give us some money to help with that, but if they didn't give us any money, we'd still have to do it. That's often the case. We have several contracts that are very similar to that. They give us a little bit of money to help with what we're going to have to do anyway. And grants tend to fluctuate, which creates challenges for us as we administer many increasingly complex grants with varying fiscal year endings. Since many of these are on different fiscal years, administering them within just the county calendar fiscal year can be challenging. For example, a grant may end the end of March and start again the 1st of April with changing requirements. We have budgeted according to what we knew for the grant period ending in March, but not for the new requirements beginning in April. Having some flexibility in budgeting helps us not only, not so that we can spend more money, as we really work to avoid that, and our staff knows that. And I believe our past record speaks for itself, but we do not have to constantly worry about how to fund new and changing grant requirements. When things are moved to restricted like this year, this presented several challenges to us as working through our grants. But I give full credit to our staff for their extra efforts in trying to make this work in most instances this year. Just a comment on our use of health fund balance. Just as the county is concerned about dipping deeply into county fund balance for ongoing expenditures, so too this is true for the health department fund balance. Our fund balance generally comes from employee attrition we experience, as well as perhaps collecting a little more in fees for services than anticipated during the budgeting process. Well, we're glad to use fund balance monies as the balances increase. I've been here long enough that I've seen us run out of fund balance a couple of times due to how things are budgetarily managed as indicated by the county, which then creates an issue for the county in using even more county fund balance to balance the overall budget. Please just keep this in mind as as our fund balance is used to balance our future budgets. Most of our new requests for 2020 are funded by grants and small amounts by added fee collections. There are some notable exceptions, which are mosquito abatement. You know, the population growth into new areas around the lake and other areas for which we previously did not have to provide services has increased the demand from residents for these vital services. You know, example, I have a relative that's built a new home down in Vineyard, and surprisingly close to the lake, you know. And as I was looking at that area between their home and the lake, I could see there's no way that we could service that area for mosquitoes. We couldn't use a plane to get into that area or buzz their homes. There's no real line of sight to use a drone or something like that. And of course, the drone we can't spray for the adult mosquito anyway. Airboats perhaps, but we don't have an airboat or staff to operate it. And even if you used an airboat to get out into some of those swampy areas, you'd sink so fast that it'd be difficult to service those areas. Bottom line is that the areas requiring treating continue to expand and continue to be more challenging and time-consuming to reach. At the same time, the cost of insecticide and professional services continue to increase as well. And I should note that of the 188,000 additional requests for mosquito abatement, over 98,000 of that is for increased costs from the internal service funds, motor pool and IT services. And then environmental health, in our 2020 request, we have included a request for an additional environmental health scientist. We also had the request in 2019 showing funding from an increase in the DEQ contract and increases in fee collections, as the Board of Health had increased wastewater fees to help fund the new position in 2019. While the position was not approved, the revenues stayed in the budget. These positions deal with food safety inspections and plan reviews, pool safety and plan reviews, wastewater installation and plan reviews, safe drinking water systems inspections, school safety inspections, complaints from bat rabies exposures to rat infestations, animal waste, flies, etc., as I've already mentioned. We have 16 of these field inspectors here in comparison to Salt Lake County, which is less than half our size, who has 63. We have a large and major wastewater program, which is septic tanks and alternative systems here, while in Salt Lake County, it's a banner year for them if they have 2 septic tanks installed. We would need to basically double our staff in order to provide something near the same level of services per capita as Salt Lake County, realizing the state requirements are basically the same for both of us. The state DEQ is in the process of adopting new gray water rules. These rules will require us to review plans for alternative use and disposal of gray water, and to review plans and inspect indoor plumbing and outdoor installations to be sure that the required guidelines are being followed. Now, gray water, of course, is water that's not been contaminated with sewage, such as water that may come from a shower, that may come from a laundry, or from a hand wash sink, for example. And those that will likely want to use gray water are often those who are on wells, so that would be in the unincorporated area mostly, whose wells maybe struggle to provide them with water for their lawns, or water for the outdoors, which gray water maybe could be used for. You know, and I believe we'll be able to opt out of the enforcement of the rules in this case. But that would mean that the residents who desire to use gray water would have to get approval from the state DEQ before proceeding. And we have 2 concerns with that in opting out. One, the state agency tends not to respond very quickly, okay, and these types of requests, and it would probably be a many-month process for residents to get things approved through the state. The second is that in the past, the DEQ did the same thing with the alternative wastewater system rules, with similar opt-out provisions. We did not opt out of those because we thought it was really important for us to be able to provide our citizens with those alternatives in many cases with the growth we're experiencing. That kind of stretched our services and resources, but I think it's proved to be better for local service rather than state service. But Salt Lake and Davis County chose to opt out of the alternative wastewater provisions. And so as the state began to receive these requests, they found they could not deal with them, so they changed the rule, forcing Salt Lake and Davis counties to administer the request. I'm guessing that we believe the same thing would happen with the gray water rule. Even if we opted out, we'd probably be forced back in. Well, many of our new requests, as I mentioned, are covered by grants or fees, but some of it can be argued are probably a combination of these and some additional tax dollars. You know, in meeting with Commissioner Lee, we've gone over these, but I will be happy to spend time with you to cover any of these requests and answer any of your questions as I shortly end my presentation. Again, we have really tried to be as efficient and effective as possible. Is there room for improvement? Clearly, there always is. But from what I've told you today, I hope you can see that any efficiencies will be drops, not buckets. But the needs are coming in buckets. As an example, in 1991, in the Health Department Administration, we had 4 FTE staff, full-time equivalent staff, and today in 2019, we have 4 full-time equivalent staff. I've noted that many smaller county departments have justifiably needed to increase their administrative staffs due to the pressures of county growth over the same period. We'll continue to seek for efficiencies, like I mentioned with our work with IHC on community assessments. Another example is our household hazardous waste program approach, which for many years we worked with solid waste districts to provide those services at no charge. With the solid waste districts bearing the costs, as the program grew, it became difficult for them to do that. And so rather than establish a $3 to $4 fee like Salt Lake County has and hire staff and to administer a program, we had the Board of Health just establish a $1 fee and have these districts continue to kind of administer that program, but reimburse them for their costs. And so we'll continue to look for things like that to save funding. We understand that tax revenue is a precious and scarce resource. You know, as a department head, I took the time at the last time the commission had truth and taxation hearings to attend all the hearings, feeling that as a department head I should hear the concerns. I believe I was the only department head to attend all those hearings. While the general tenor was fairly one-sided, I believe the message was that our citizens expect and deserve efficient county government at the best possible cost. I believe we have been largely meeting those citizen expectations in the health department, but have just not really kept up with the demands of rapid growth and added unfunded mandates, basically. I appreciate the Commissioner's willingness to go before the citizens to request a tax increase to fund county government. I look forward to working with the Commission in the coming months to finalize the budget. So questions? Again, I have staff here that are just on pins and needles, wanting to wanting to
No,
respond.
I appreciate Ralph. I know we've gone over all these numbers and looked through them. I do have an observation. It's always interesting to me that we tend to do a lot of comparison, and we compare all over the state. But can you give us an outline of where we sit as a health department compared to the others in the things that we do right? I mean, our population is among the healthiest
Right.
in the state of Utah.
Very true.
When we look at the work being performed, I don't know where we'd rank, but I think we rank right up there in the top of general health and also, you know, the programs that are being administered and being done. In the areas where I go with you to certain other meetings outside of county where we have multiple county areas, it appears to me that we're in some regards a model of how it's to be done. So I find it kind of contrary to a certain extent if we're the model of the state, then we also, and on a funding level, it seems to be working. What's going on with the others? Why are they spending so much money?
That's a great question. I can tell you, I can answer it, I guess, in this way. Maybe with some examples. We are a very healthy county, which helps us and probably makes it so we don't have to spend as much in public health as some of the other areas. There are areas, you know, such as the Carbon area where the opioid epidemic, I mean, we can say it's terrible in Utah County, but in Carbon County, it is many times worse. And so, you know, there's savings in those areas because we do have a healthier population. But then we have to kind of prioritize things. You know, for example, when I started in the health department doing inspections. And we used to inspect all the campgrounds. We'd inspect all the rest stops. We'd inspect the jail. We'd inspect all the hotels and motels. Now we simply only do those if there's a complaint. We just don't have staff that can go in and inspect those on an annual basis. Hopefully that's good enough, you know, because we have to deal with the realities of the money we have, you know, where other places maybe can do a little bit more than that, you know. We do not inspect beauty shops, for example, which Salt Lake County does, you know. There are rules for beauty shops to make sure they're doing certain things in a sanitary manner. We would respond to a complaint in those cases. So we've had to choose in many cases to not provide the services that some of the health departments do provide.
Are complaints higher than on a per capita basis?
They
than-
probably are a little higher because of that, but we used to inspect trailer homes, you know, trailer parks, mobile homes, and having crawled under many a mobile home to do the inspection back in those days, it's not a very fun process, especially if there's a problem. But in most cases, if there is a problem, there's probably going to be a complaint. You know, if somebody's sewage connection under their mobile homes come apart, which happens, generally somebody's going to complain about it, and then we'll go out and handle it on a complaint basis. Yes, it would be nice to probably have the staff to inspect and do those kind of things to prevent it from ever happening. But we do what we can with what we have. But yeah, we are fortunate as a community that we are a very healthy community. Our tobacco use rates are less than most places. Unfortunately, like most communities across the country, our e-cigarette rates are increasing rapidly amongst our youth. We've been up at the legislature trying to get some funding for e-cigarettes for about 4 years. Hopefully this year it'll work. But the interesting thing is about politics is you go up there and they say, okay, we're going to tax e-cigarettes, but then they always find ways to use the money other than for enforcement.
Ralph, a couple follow-up questions on that line there. Did you have a number for the state average that a county spends per health, in their health department per capita?
I state average? No, I didn't do that. I could probably do that.
I would just be curious what the average in the state is.
Yeah.
You mentioned a few counties in particular, Morgan County. What do they spend per capita?
It was just a little over $11. And
Compared to what we spend
compared
is,
to what we spend per capita. And then, of course, Morgan County is probably considered the most healthy county in the state.
it is, according to the research I just looked up. And then Summit County,
Summit County is $75.32 per capita.
which is ranked number 2. Wasatch County
$23.56.
and Davis County
Davis County, $14.91.
and Cache.
Cash would be $7.41.
I was just curious, what about, so those were the top 5
Those
listed.
are the counties that, on that particular health ranking, are above
Yeah.
us, yeah.
What about Duchesne?
Duchesne would be in that $17 to $19 per capita.
And Garfield?
Garfield would be down in the small counties, rural and southeast. They would be somewhere in the 6 to 930 per capita.
And Emory and Carbon, are
They
they're
would be,
joint,
they
right?
would be in that same category. I kind of grouped those together.
And San Juan, I think, is part of a
San Juan is
multi-county health
about,
department.
San Juan's separate. San Juan would be the southernmost county, would be in the $9 to $10 range.
I was just curious, I mean, we go through this, it's, to me, this is always one of the hardest discussions, right? Because we talk about it in education, we talk about it with health, does spending more equate to better outcomes? And there's so many factors in it. I think it's an important factor. It's part of the overall equation.
But it shouldn't be the only
But
factor.
it's not the only factor. And,
Not when we're so healthy, anyway.
right, and I guess that would be part of my question. What do you think that the health department brings to the community that makes it healthier? Like, what are we doing within the community that particularly makes the county healthier?
Well, I think many of our efforts really help to make the county a healthier place. Our emphasis with school nursing and the resources we put into school nursing in our communities, that's where we get a big bang for the buck. I mean, those folks, they're dealing with a lot of children, our most precious resource. If we keep children healthy, they're likely to be healthier as adults, and so that's
Schools
one
are a
area.
cesspool for bugs.
Our mosquito abatement services are really outstanding for the price. I mean, if you look at what they spend on mosquito abatement in Salt Lake County, and then I realize Salt Lake County has some of the same marshy issues that we have with Utah Lake and things. We're doing a bargain, but we use a lot of seasonal staff instead of hiring staff and keeping them on full-time like they do up there. We try to find those efficiencies to still provide the service and protect the people. But, our outreach services through health promotion is great. We do, of course, have a great immunizations program. People actually come from all over the state to get immunizations in Utah County.
Okay. In summary, then, I guess you'd say if we're to try and find a place to put additional funding, it's in school nurses.
School nursing would be a
And
place.
that's interesting, though, that seems to be the place we seem to be the most behind.
It
But
has been.
In past years, it seemed like we're one of the lower numbers in the states as far as nurses per student.
Actually, we're probably better than most places in the state, but we're far below what the national standard is.
Okay.
But again, we do the best we can with what we have, and it's been great.
And we've
Yeah.
shifted a little bit. The schools are picking up a lot more.
Yes, we've been
then-
pushing the schools to pick up a lot more of that, and they've done
They're
that.
picking it up, so,
Yeah.
I mean, they see the need, and they're the ones that usually ask. for
Yeah,
it.
the relationships there has been outstanding, and it's helped us in so many ways in the communities with the school nursing program. I I hate to pick out one because all of the programs are really, really important, but
Appreciate it.
that's a particularly important one. That's probably our biggest program besides, so. So I guess if that's the most important and it's our biggest program, maybe we're on track a little bit there.
Okay. All right. Thank you.
Okay.
Anything else?
I hope I kept you ahead of schedule, huh?
I
You
think
did.
you probably
Good.
always do.
All right.
Thank you.
Thanks,
Thank
Ralph.
you. Uh-huh.
Thank you. All right, that is the end of our work session. So we will close. I don't think we even need a motion to close, so
No, I
we're
don't
just,
think so.
we're
We're
done.
good.
Just go ahead and push the button and say we're done.